Welcome to As the Dinosaurs Turn, where we chronicle the adventures of the Dinosaur family, a seemingly ordinary family from Iowa who decided, hey, you only live once, so let's move to Portugal. And now your hosts, Jason and Tracy Dinosaur.
All right, welcome to another episode of As the Dinosaurs Turn. We're in separate rooms this time because some people in the house are ill and some people are not, so we're trying to quarantine as best we can, I guess, but we said we'd do these weekly, so I was actually prepared to do it myself if I had to.
Well, you might have to. We'll see how this goes. I'm trying really hard here.
Well, what do we need to talk about this time? I don't even know. We've talked about burnout. We've talked about why we're here. I don't know. We hadn't done one before, April 15th or so was our last one before we started a few weeks ago. So I guess there's a lot of ground that we could cover.
There are so many things. I'd say that one of the things that we're learning is that with burnout, if we continue some of the same patterns that we've had before, that we're going to achieve burnout just as quickly, or we could. And I think that that's one of the things that we need to keep in mind as well. Like, we're recovering from all of those and we're feeling inspired and creative. But sometimes some of us do too many things and then we end up getting sick. So I think that we have to keep that in mind. So we're trying to do some of that with scheduling in particular. Like, you don't have webinars every day of the week. Before, you were giving webinars sometimes 2-3 times a day. So it's nice to have some breaks there and have some exclusivity agreements that help with that. I don't know.
I think we're busy, but we try to keep control of calendars and I don't know. I know a lot of what we do outside of work is running errands, it seems like, but at least that's not work.
Yeah, that's definitely true. And we have time to actually do some of those things throughout the day, and I think that that's helpful. It's not always like, 10 o'clock at night or 8 o'clock at night, let's go and try and get this stuff done. So that's nice. And we've been pretty conscientious about not having too many things to get done in a day. Because we're living in a country, one, where that's impossible. But two, that definitely helps with us overloading or not overloading.
Let's see, what else can we talk about? You and I both have had various, and have for years, various medical things that take us to the doctor every now and then. And we knew some wonderful doctors in the United States. The doctors here are very good too, I think. There's the cost of things. I had to have an MRI done on my neck and a series of x-rays on my spine. And we do have, it's hard to explain how it works, I think, because it's public healthcare, but there's also private insurance. I don't know, how would you describe private insurance? It's like it kind of lets you, doesn't it let you cut the line a little bit in some cases? And it also lets you do some things that are kind of more voluntary, I guess, as opposed to the public system is more for you're not going to go bankrupt if you have to be hospitalized or you get cancer or something like that.
No,
Insurance is more for the other things.
I think you've lost your mind. No. So we are not from this country, and we do not pay into Social Security and all of those things. We can be part of the public health system. We do have public health numbers. There's a problem with the setup there. There just aren't enough public health doctors to go around for everybody all of the time. And so because we are able to pay for private insurance, we definitely do pay for private insurance, but it is nothing compared to health insurance in the United States costs. even with paying into Social Security every month to be able to use all the health benefits in the ways that you would want to, it's only €60 a month to pay in. So it's very different. We pay $275 for private health insurance, but since we're in our first full year of private health insurance, there are certain things that aren't covered all of the time. So Jason's MRI was an out-of-pocket expense, and it was like €300.
The total, yeah, I had an MRI, x-rays of my spine from top to bottom, and blood work, and I think it was all a total of €400, so like $450, without insurance covering any of it. That's just what my out-of-pocket cost was. Whereas in the United States, how many $10,000 probably to do an MRI of your neck, most likely.
Well, so the costs of medical care is definitely lower. It's like there's negotiated rates or something. I don't know. Like all of our medications are at a much lower cost. There are two levels. Oh, there's a cat here. There's a camera butting around. He's trying to like rub himself all over the tablet. But there are two levels of medication costs. One is with participation within the public health system, and one is without. And so with gets you a discount on medications, and without you pay the agreed upon price. But we're talking about like the medications, like we got 3 months worth of medications for 3 people for €30. So the agreed upon price, like even non-participation, is much lower. And I think it's because they've actually enabled you to be able to do all of those types of negotiations. It also is based on what people can actually afford. And I think that that's important to keep in mind as well, that the pay in Portugal is much lower than it is in many other countries. And that health here is definitely seen as a public service and a right. And it's something that everybody is expected to be able to use, just like the bus. So I think that that's one of the things that I truly appreciate. But I also feel like the approach is very different. Like, I mean, most of the doctors speak English on some level, maybe not as fluently as they would want to, because they want you to learn the medical terminology. They know it in Portuguese, but in saying that in English. So sometimes there's a little bit of a disconnect there, but it's been very easy. But they actually listen to your symptoms, I think, in a deeper way than what we experienced in the United States with some doctors. I had a wonderful rheumatologist in the US, so he listened to everything, but that was, I felt like, the first time somebody really listened to me and had a conversation with me. Whereas here, every single doctor really wants to get to know you, and they're like, so you have this symptoms, and then they're putting things together in their mind. They're like, oh, well, let me guess, you also have this, and you also have that, and you also have this, and you're like, yes! Like, well, that makes perfect sense. So, I don't know.
I think it's also interesting. Maybe it's this way in other countries. It's not this way in Portugal, where it's like, oh, it takes 9 months to see a doctor. So I've had to see an ear, nose, and throat doctor several times in my life, including in the U.S. because I'm strange and I have salivary gland stones occasionally. And I had one back in December, actually, first time in Portugal. And we could get in to see an ENT the very next day. Now, maybe it's not that way everywhere throughout the country, but it was here, whereas in the United States, you'd go to your primary care doctor to get immediate treatment, I suppose, and then wait 6 weeks or 8 weeks to get in with the ENT.
Well, and to be clear, that's also paying out of pocket at a private hospital. But paying out of pocket at a private hospital is not something we would consider expensive either. I love when they actually apologize that you might have to pay out of pocket for something and then get reimbursement from your private health insurance. paying out of pocket at a private hospital is between 60 and €80 for the visit, depending on what it is. With your insurance, it's like 19. I love it's always 19. It's your kind of copay. Um, but at the same time, I think that you're right. You have the availability, whereas I expected even in the private system to not be able to get into anything for months and months and months, and that's definitely not the case. Like, yeah,
I guess we should say 60 to $80 out of pocket. If we're talking to an American audience, that's
it's
probably a
nothing.
pretty good deal. To a Portuguese person, 60 to $80 is a big deal, though, for a
It
lot of
is.
folks.
It can be very expensive, and I think that that's the reason why, people like you can get up really early and wait in line outside of the health center to get an appointment for urgent need. You definitely can do that. The hospital here in town also starting at 8 p.m. sees health, like they call them SNS, so the public health clients. And then you don't have to pay, or you pay like €4 instead of 30. So it also depends on your hospital, on how much you're going to pay. So, but yeah, out of pocket cost is very different. But I also feel like the philosophy is very different here as far as medications and taking medications, but also um, really concerned about you as individual holistically, and not a problem to be like, oh, well, we have to go through this whole big long series of tests before you could actually access that MRI. It's like, nope, we're going to do it all at once. So you literally went in and were there from like 8 o'clock in the morning until like what, like noon or something, had all of those
Noon
tests
or
done all at
thereabouts,
once,
yeah.
all in a row. And it was like they scheduled it and it was fine. So I think that there's not all as many hoops to jump through to get your insurance to pay for things either. If the doctor says you need it, then you need it. And then there are some things that, I went and I had to have some precancerous treatments, nitrogen things burned off my face. And I thought, oh, you pay for your consultation and then you have to go back and pay for your exams. And it was like, good Lord, how many hundreds of dollars is this going to be from a dermatologist? And it was €3. And so I think that, you're paying for all of these little pieces of things, but each one of those pieces is definitely cheaper. I don't know. Some of the mystery things, though, that even you have dealt with or had questions about, and they're like, oh, well, let me guess, what about X, Y, and Z? And do you have this and do you have that? And you're like, yes, I do. They're like, well, it's no wonder. Like they've really kind of listened. And I know, at least in the States, every time Jason would talk about these rare things that he has, especially with these stones, he gets this big gland infection. His whole face puffs up. And he had a tear duct that just like his tears were constantly running and had to have surgery. Every time he has this conversation, he was like, I'm sorry, I know this sounds crazy. I know this sounds crazy. And in the US, they'd say, yeah, it does sound crazy. He's never once heard that from a doctor here ever. He was like, oh, no, absolutely. That makes perfect sense. Yes, this is definitely a real thing. Like, and so I think that's the other piece of it. There's like some element sometimes in the medical system in the United States that if you have a symptom, oh, you must be looking online and thinking you've got all these crazy things and you're a hypochondriac and that can't be a real thing. Whereas here we're saying, yeah, no, they're like, oh, I know about this symptom. And then what about this? Do you have that too? Do you have this? And like, there's also an idea of treating things. And then there's also the idea of like when you should consider surgery and when you shouldn't based on your own quality of life and length of life. You would have to be dealing with something like it's better for you to have a surgery in order to not have to be on medication for the entirety of your life, instead of just taking your medication. Like we're learning all kinds of interesting things. Like I didn't know some of these procedures existed at all. So you go down the health rabbit hole, and we have not had a bad experience with the doctor yet. It's just been completely positive. And I love our pharmacy. I do. I love our pharmacists. So,
Yeah, we have our favorite pharmacy, and well, all of them are good. I like all of them in that particular pharmacy. and they get to practice their English on us, and we can practice our Portuguese on them. I had to go in there by myself one time, and I got the other guy. He is friendly too, but he doesn't really know who I am, and I don't think he recognized me either. And all I heard was and I looked at him and he repeated himself because when people talk fast, that's how it sounds to me. It's just like
You're like,
he was asking if I wanted generic or name brand is turns out what he was asking, but that's, I must have looked like a total idiot. And so then he put his finger on my name on the piece of paper and he said, English? And I said, yes, please.
No, but I really enjoy like the number of people that we've gotten to know and that they're like, oh, I just want to practice. Just even, one of the best pharmacists, his name is Nelson. He's got quite the sense of humor and is very nice. But even having conversations like with the medical doctors who are like, oh, I need to practice my English more and I need to listen to more English and have higher level conversations than just, hi, how are you? Because I go to a conference and my field is all in English. And here in practice, I use Portuguese almost all of the time. And so it's so nice to have English speaking clients. It's been entertaining. But then
we're working on that.
Yeah, and we've had doctors.
I have an idea on that, so.
You have tons of ideas. You're never going to, he's never going to run out of things to do. But I would say that also, even the doctors who have spoken Portuguese have spoken very slowly to make sure that you understand, and you understand what's going on, no problem. You don't have to worry about that. So that's a good thing. No, but it's appropriate since I've got the crud and the boys have the crud. But I think it's just the time of year. It's also been very wet and cold. Well, cold for us. It's a cold spell for us. It's not really that cold in comparison to some of the things we see in the U.S. So, but rainy and damp has been the reality. Yeah. So we all have got like this sinus crud where you might have a fever and then you have to go to sleep and all of that. It's going around everywhere. Knock on wood, we haven't gotten the bad flu yet. That's a good thing. We know that we've already had some version of COVID at some point in time. They're like, oh yeah, just accept that you've had it. You're good now. Like, let's not worry. That's the other thing, thinking about COVID. There are very different philosophies here. And then, yes, the booster shots and all of those things are completely available, but they are available to people over 60. And that is kind of the threshold, and starting in like September. And then the younger populations can't get those until November, at least in our town. If you're lucky, December. And then by then we'd already had it. So it was like, well, here you go. I guess we don't need it now. Because we went to the hospital because the symptoms just wouldn't go away. Jackson just couldn't get his symptoms to go away. They're like, oh yeah, you've had COVID. That's just what's going around right now. It's fine. So.
Well, we wanted to get our weekly podcast up. So, as usual, we had no real agenda and somehow we filled nearly 20 minutes. So.
I think we're good at that, apparently.
Apparently. Well, maybe next week we'll all be healthy. I haven't caught it yet, knock on wood.
I was going to say, you better knock on something because Tyler's got a little bit of cough and then I've been like this for a little while and poor Jackson's just down for the count. So it's coming your way. Be prepared.
I'll just stay locked in my office and we'll
There
see
you
what
go.
happens. All right. Join us again next time on As the Dinosaurs Turn.
You've been listening to As the Dinosaurs Turn, a podcast presented by Dinosaur Media Ventures. Don't forget to like and subscribe, and catch us again next time for another episode.